name is Kayla Honey, and I'm going to be presenting Genetic Disorders by Ash, Nadia, Caleb, and myself. A genetic disorder is a disease caused by abnormalities in a person's DNA. Today we'll be discussing Tourette syndrome, Fragile X syndrome, and Angelman syndrome. Tourette syndrome. Tourette's is named after Dr. George Gilles de la Tourette, pictured here on the right, who discovered the disorder in 1885. The first to be diagnosed with the disorder was an 86-year-old French nobleman, Marquis de Dampierre. The idea of Tourette syndrome was widely disputed until cases slowly increased worldwide throughout the 1900s. The acknowledgement of the disorder led to the founding of the Tourette Syndrome Association of America in 1972. Here's their logo on the bottom right. Tourette Syndrome Awareness Month is May 15th to June 15th. Tourette syndrome is a disorder that can involve repetitive and uncontrollable movements or sounds called tics. The disorder develops during childhood and in most cases slowly recedes in its severity as the child ages. However, once diagnosed with Tourette's, it will never go away. Physical or movement tics are called motor tics. These can include just about any movement imaginable, from rocking your head back and forth, shoulder shrugs, blinking, etc. Audible tics are vocal tics. These can range from blurting out random words, throat clearing, a variety of random noises, etc. Tics can also be varying between person to person with Tourette's on an extreme level. Some people's are so severe that they have to touch or smell certain objects, walk in a certain pattern, or make obscene gestures to satisfy their tics. There is no exact count on how many people in the world have Tourette's, or even an approximation of the population with the disorder. Here on the left, you can see all of the areas of the brain that Tourette's affects. Studies conducted by the CDC have shown that every 1 out of 162 children has Tourette's syndrome. They believe that only half of the children suspected of having Tourette's have been diagnosed with the disorder. 86% of people diagnosed with the disorder have also been diagnosed with another disorder. The most prevalent of the disorders that they have been paired with are ADHD, OCD, ODD, and various anxiety and depression-related issues. There is no definitive cause of Tourette's syndrome, but one of the most common theories is that Tourette's is a genetic disorder. Tourette's is a dominant gene, and if a genetic ancestor carries the gene, then there is a 50% chance that it will be passed on to their children. Boys with the gene are at least 3 times more likely than girls to show symptoms or be diagnosed with Tourette's. Although there is no cure or medication designated to fight Tourette's syndrome, there are ways to treat the disorder to limit its severity. Medications aimed to block or lessen dopamine, like risperidone or Orap, are the most commonly recommended by doctors to treat Tourette's. Botox injections are also commonly used as treatment. They're generally less effective and can be longer and more painful than the average shot. Behavior therapy focused on habit reversal is the best treatment option for people who choose to opt out of medications. Famous people with Tourette's include Billie Eilish, Tim Howard, and Dan Aykroyd. Fragile X syndrome. Julia Bell, pictured here on the right, discovered Fragile X syndrome. In 1943, Julia Bell and James Purdy Martin, pictured on the left, discovered a form of the sexual mental retardation that is inherited from the X chromosome. Because of their contributions, the syndrome was initially named Martin-Bell syndrome, but the name was changed to Fragile X syndrome later on. FXS is another name for Fragile X syndrome and is a congenital disorder, meaning it develops prenatally and is present at or before birth. FXS causes a range of developmental problems, including intellectual disabilities and cognitive impairment. It affects both males and females, but is more typically severe in males. Fragile X syndrome occurs when there is a change in the FMR1 gene. This gene makes the protein known as Fragile X mental retardation protein, FMRP, which is needed for normal brain development. People who have FXS do not typically make this protein, but it has been found that they make a small amount. FXS is caused by a methylation of CGG triplet, resulting in its amplification. The amplification of CGG results in the silencing of the FMR1 gene. Normally, the DNA segment CGG is repeated from about 5 to 40 times. However, the DNA segment is repeated more than 200 times in those who have FXS. Physical abnormalities include long, narrow faces, ears that stick out farther than 2 centimeters from the side of the head, prominent jaw, and abnormally large testicles. FXS causes intellectual disabilities, attention deficit, hyperactivity, speech delay, sensory integration problems, and seizures. The intensity and frequency and duration vary greatly from person to person. Anxiety, social interaction difficulties, hyperactive disorder, self-harm, injury, aggression, hyperarousal, repetitive movements are also common in those with the disorder. A premature carrier is an individual, male or female, that has between 55 and 200 CGG repeats in the Fragile X FMR1 gene, while one with the full mutation has over 200 repeats. Women with the FMR1 gene have a higher risk of having a child with FXS. With men, the CGG repeat remains the same size or shortens as it passes to the next generation. Males and females with Fragile X premutation have normal intellect and appearance, but few do have subtle intellectual or behavioral symptoms. FXS affects about 1 in 4,000 males and 1 in 6,000 to 8,000 females in the USA. Since FXS is an X-linked neurodevelopmental disorder, females are less likely to show severe signs of the physical, cognitive, or behavioral phenotypes of Fragile X. Unlike females, males only have one X chromosome, so an inherited damaged copy is their only copy. There is no cure for FXS, however, there are therapies for the disorder. Medication can also be prescribed to help manage behavioral issues. It is important that children with FXS start therapy as soon as possible, as it increases their opportunities of learning and developing skills. The test for Fragile X is called the FMR1 DNA test for Fragile X, and it determines the CGG repeat count. As many as 1 in every 150 women and 1 in 468 men are premutation carriers of Fragile X gene. Fragile X is diagnosed through a DNA sample, usually through blood, but amniotic fluid and other tissues can also be tested. 2 to 6% of children with autism are diagnosed with Fragile X syndrome as well. Angelman syndrome. In 1965, Dr. Harry Angelman, pictured here, published a research paper discussing the symptoms he observed in children while describing the disease. In his paper, he referred to the disease as happy puppet syndrome. The disease would later be named after him for being the first to identify the disease. Angelman syndrome is a genetic disorder that mostly affects the nervous system and causes delayed development, the problems with speech and balance. The disorder that can also lead to intellectual disabilities and seizing. Here you can see the difference between a normal gene and the gene of someone with Angelman. Angelman syndrome usually occurs when the part of the maternal copy of the UBE3A gene is deleted, missing, or damaged. The disorder can display very distinct phenotypes in individuals, including smaller head size, wide mouth, sunken nose, small chins, as can be seen in these pictures. Most children affected by the disorder have a difficulty sleeping and need less sleep than usual children. They may also experience delayed development, which usually begins to be noticeable around the age of 6 to 12 months. Reoccurring seizures is also a common symptom from the disorder. These symptoms of the disorder can be displayed as early from 1 to 4 years of age. Children with Angelman syndrome typically have happy, excitable demeanors with frequent smiling, laughter, hand flapping movements, but also exhibit intellectual disabilities, severe speech impairment, and problems with the movement and balance. The exciting behavior tones down in adults, but intellectual disabilities and severe speech are still in effect. There is no cure for the disorder, but treatment for Angelman syndrome can include medication to prevent recurring seizures and control the frequency of seizures. Angelman syndrome is rare, and most people with the syndrome do not have a family history of the disease. Occasionally, Angelman can be inherited from a parent. Family history of the disease may increase a baby's risk of developing the disorder. It is important to note that an individual with Angelman will have nearly a normal life expectancy. In 1991, former Major League Baseball pitcher Brian Harvey donated $20,000 to the ASF for Angelman syndrome research and family support. The donation kickstarted their research and led them to become incorporated in 1992. Since then, they have been committed to research, finding a cure, and supporting AS family. In conclusion, Tourette's syndrome is an incurable disorder that is genetic due to being a dominant gene passed only by parents. Fragile X syndrome is a genetic disorder that is a result of mutation in the FMR1 gene sequence. This disorder can be inherited and is also incurable. Angelman is an incurable genetic disorder that is a result of the loss of the function of a gene known as a UBE3A on chromosome 15. Gene deletion most commonly in maternal copy of the genes. Thank you, and that's it for today. Thank you for all of your time. Have a great rest of your day.